here at the Mental Health Summit at the VA Hines Hospital, where the summit is addressing the crisis of veteran suicide. There are several speakers here, among which are the chief of the health service line, Dr. Thomas Nutter, and also many social service agencies are here to show people the many modalities that there are for preventing suicide, recognizing the signs, preventing suicide, to help stem this crisis of 22 veteran suicides per day. From the perspective of ADAPT, there are many disabled veterans who have difficulty with access public facilities or access to employment. These can create mental health problems. And so we're going to interview a couple of people here and also give some information about how to get connected.
The event today, which is a very special thing for us, is this is our 4th annual Mental Health Summit, in which we can invite in community partners and just kind of not only let them know things that we do, but hear about things that are going on in the community, and probably most importantly of all, network with one another, because although VA is expanding a lot of our programming and a lot of our supports for families, in many cases the family member may not be eligible for VA services, and so the more closely we can collaborate with our partners in the community who can deliver those services, the better. As I said, there are many things that we are able to do here, and we've been expanding a lot of those efforts over the last 2 to 3 years, but there's still a lot of things that we can't offer in the same way that the community can, and we're thrilled to have everybody here today for the summit.
Dr. Nutter, support for veterans and families is important at all stages of suicide prevention. Can you give us a little bit, tell us a little bit more about that?
Yes. One of the challenges of suicide prevention is that it can be a very difficult thing to predict. It's hard to know who is at high risk. It's hard to know when they're at high risk. And many people who complete suicide and who attempt suicide do so somewhat impulsively. And so the tighter that we can keep the web of support for any individual, particularly any individual veteran, so much the better for all of us and for suicide prevention. There's very clear literature on social connectedness being a protective factor against suicide. There is very clear literature that employment is protective against suicide. There is clear literature that being engaged in treatment is preventative of suicide. And so one of the things I was emphasizing this morning is that we tend to sometimes think of little things that we do as not being important in suicide prevention, sort of the taking someone out for coffee, watching someone's children, just checking in to say, how are you? And those are actually some of the most, when added together, those are some of the most important pieces in keeping that safety net a viable, functioning one for our veterans and for anyone who is struggling with thoughts of suicide.
If you are concerned that someone that you care about might be at risk for suicide, things that you might look for would be, has this person have any personality changes? Are they agitated? Are they withdrawing from you or from others? Are they not taking care of themselves? Are they feeling hopeless? This does not necessarily mean that they are suicidal, but it is something to be aware of, and at that time you might want to provide some support from them. Give them a place where they can talk about anything that's bothering them, but just be open and accepting and encourage them to stay connected.
We're here with Lieutenant Commander Tom Miller, who is the chair of the Board of Directors for Joining Forces Illinois. Pleased to have you with us, sir.
Well, thank you. I appreciate it.
Can you tell us a little bit about Joining Forces?
Sure. Illinois Joining Forces was originally convened
by the State Director of Veterans Affairs and the State Director of Military Affairs. And that was in 2012. In 2014, the General Assembly and the governor signed into law an act creating Illinois Joining Forces Foundation. And we just kept the name Illinois Joining Forces. It's a 501c3 non-for-profit organization. And what we are is we're a public and private organization that help veterans, service members, and their families navigate the sea of goodwill that is out there. Illinois has over 500 not-for-profit organizations, in addition to the military and the VA organizations, to help veterans. And that can be sometimes a confusing, thing to navigate. So by having a single, overarching organization that brings all of them together in a kind of a backbone organization, and they become members and they build relationships. We have working groups. There are 9 working groups where these organizations participate in these working groups. I happen to chair the Behavioral Health Working Group. We have over 200 organizations in Illinois that are members of Illinois Joining Forces. There's also, folks may have heard of Joining Forces. That was an effort by the White House to do the same thing on a national basis, a national level, and that has evolved into joining community forces, which again is organized in each state by the National Guard, and the National Guard decided to use our existing Joining Forces organization. Then part of that is the VA's My Communities, and My VA Communities organization, and the purpose there is also to build relationships with all of these organizations to help veterans, because it can be confusing as they're trying to navigate this sea of goodwill.
Have you seen work being done for veterans with disabilities gaining better access to public facilities and also to employment?
Sure. So of the 9 working groups that we have, one of them is job training and employment, and the emergency and benefits, women veterans, financial literacy. It really runs the gamut across the things that can occur in one's life. And all of this is about making every one of us sensitive to the unique experience of military service. In terms of job and hiring people with disabilities, there are programs across every level and domain in the country that recognizes that, if a person with a disability can get a job, then they won't be homeless, their mental health will get better, and they can live a full life in the community as they choose.
Lieutenant Commander, thank you.
Thank you.
I'm here with Angela, who is a recovery support specialist at the Drop-In Center for the National Alliance on Mental Illness. Hello, Angela.
Hi, how's it going?
Good. And we're here with Jeff also, who's also a recovery support specialist.
How you doing?
They are here at the Mental Health Center at the VA Hines. Can you tell us a little bit about National Alliance on Mental Illness and what you do?
So the National Alliance on Mental Illness, we're called NAMI for short, and we do all kinds of things with education, advocacy, and support, and getting rid of stigma, which is also really important. Today we're here at the Hines VA Health Summit, and we're talking about one of our veterans programs that is a support group called Connections. And it's a support group we have at a lot of different places, but we also have it here specifically for veterans to come to get some support and talk about things going on.
Okay. Jeff, would you like to add to that?
Yeah, we're proud to be here today as National Alliance on Mental Illness at this particular health fair, and we recognize that there is a great concern out there that veterans receive proper mental health services. And we're just very proud to be here as NAMI. And today we're going to tell you a little bit about some of the things we offer. We have a NAMI drop-in center. It's located 814 West Harrison in Oak Park. And at this particular place is like our headquarters for NAMI Metro Suburban. And you can come in whenever you want. And there's a bunch of groups and activities that people like to engage in. And there's art, and there's also therapeutic type groups, support groups, and everything. So we're just very happy to be here at this health fair, and we just want to help in any way we can.
Angela, Jeff mentioned art. You use art as part of therapy for people who are seeking mental health?
Yeah, we do. We have art therapist that comes in twice a month, and not only do we have like the hands-on art, but we'll have open mics, and we even have a performance troupe that's performed at the Thompson Center and Soldier Field and Blues Fest.
Really?
Yeah, it's really cool. So just like music is very powerful in recovery.
And is there a way for us to reach NAMI?
Yes, the website is namimetsub.org.
NAMI.
METSUB.org.
Yeah. And so that is a place where people can get information, Jeff, about the organization. Can you tell us a little bit more about that?
Yes, at the NAMI Drop-In Center on 814 West Harrison that we just were explaining, people can get all kinds of different help. Like Angela had mentioned earlier, for veterans, we have the NAMI Connections group, which is also for people with mental health issues. And we also have a peer-to-peer recovery education class. I've actually taught that class 13 times. It's a very valuable educational class. And we have other opportunities for people who come there, for the participants, to get more involved in their own recovery, maybe to work towards a volunteer opportunity or to get a job. So we try to provide people with resources and the direction of the recovery that meets their needs.
Yes, I have just one more question, and I would like you each to answer it, and that is, how does the organization work with people with disabilities to help them gain access to public facilities or employment? How do you do that?
Well, we have available at the NAMI Drop-In Center, we have an employment specialist, and we have resources there where participants can talk with the facilitators on duty to determine their own needs and work with a special employment specialist team at the Drop-In Center, in which people will have a chance to build the resume and go to job interviews and actually go on the interview with one of our staff members. So we do have those opportunities and education as well.
Angela, would you like to add to that?
Well, what Jeff said is right about our employment team. They're always helping people find jobs, and as far as other things about, preparing them to go into public and stuff, I mean, we offer like resources. We have different places in the community we refer people to, food pantries and different mental health centers. So that helps. But I think like just them getting into the feel of coming there, getting into the groove of socializing with people who are in similar places. I mean, it's amazing what a good fellowship we have there, where like you can walk in and have a bad day, and the other guy sitting next to you will be like, yeah, I've been there.
Right.
And just very supportive.
The peer-to-peer support.
Absolutely. That helps people gain confidence to get back out there working or whatever they need to do.
Okay, so when people come to your organization, you have a wide variety of modalities to help them, but you're also in partnership with other organizations like the VA, like the food pantries, as you mentioned. So it's a network.
Absolutely. Yeah, I mean, we're all working together towards a common goal of, people being healthy and feeling good. And so if we can refer somebody to somewhere else that works better for them, that's great, as long as they're getting what they need.
That sounds terrific. Thank you both very much for this interview. I really appreciate it, giving us an insight.
Thanks for giving us a chance.
Yeah.
Project Welcome Home Troops. What we do is we teach breathing techniques that have been shown to reduce the two most intrusive symptoms of post-traumatic stress. And people think, oh, you know, I breathe. I already breathe. Why do I need to breathe different? And the thing is that the breath has a big secret, and that is it can really help us to manage our mind and negative emotions. Because if you just think, how long can you hold your breath?
Right, right. And
Very
I
short
think
time.
49 seconds is
49
my
seconds.
record, yeah.
Yeah, wow. Yeah, it's a very powerful way to calm down the mind. And the course actually has a toolkit of a variety of different techniques you can use in the moment to bring yourself back to center. So instead of reacting to a situation, a person, or a circumstance, you just can use these techniques and you calm yourself down so that when you respond, it's in a way that you would be proud of. And it just brings back a lot of empowerment to the person. And we teach program for not only the veteran community, but also the general public. And spouses and adult children are also welcome to come. The one thing is it's not therapy. So it's not something, you know, that you have to do every week, but you do get a daily practice you can do on your own. So with that, you calm yourself down and you get more energy, more happiness, more resiliency to deal with your life, what's happening.
More resiliency to stress. In the pamphlet here, it says, resilience training for optimum performance.
Yes.
So this is something that is applicable to both people who are active military service, but also
Absolutely.
veterans dealing with PTSD
Yes.
or disabilities.
Yes, absolutely. Absolutely.
So let's for a moment, let's breathe properly.
Okay.
Take a nice deep breath all the way down into your diaphragm. And you fill up from the bottom up. And then you just let it go.
Right. Very good. Very good. Yeah, very good.
I have some training in yoga.
Okay.
But yes,
That's very helpful.
meditation and yoga are some of the modalities that are being explored to help combat stress and also for suicide prevention. Is that right?
Yes. Yes, absolutely. Because what they do also is they lift up your energy level so that you're not feeling as low, you know, and just make you feel more in charge.
Okay, so it is called Power Breath Meditation Workshop.
Yes, Power Breath Meditation
Power
Workshop.
Breath Meditation, stress relief for veterans and military service members. And this is Pam Brockman.
Yes.
And the organization is called?
It's called Project Welcome Home Troops.
Project Welcome Home Troops.
Yeah. And my telephone number is 847-903-9674. 847-903-9674. And our website is www.pwhtisandtom.org.
That's very inspiring, Pam. Thank you for being with us.
Thank you so much. Great.
I'm here with Michael Fleischer, licensed social worker at the VA Hines Hospital. Welcome.
Thank you. It's good to be here.
You have a modality that is used for identifying signs of suicide. Can you talk to us a little bit about that?
The primary thought that's in most clinicians' minds when they begin the process of being helpful to veterans is to think in terms of what we call the biopsychosocial model, that all conditions that people come to us with, wanting help with, have a biological aspect, a psychological aspect, and a social aspect, so that people are given at birth some genetic predisposition towards depression, anxiety, and it becomes part of what they might potentially have, but not necessarily what will be their destiny. Much like diabetes or heart disease, tendency does not mean that you will have the condition. very often stress is encoded in people's biology. Stress hormones, neurological changes based on trauma. So that medication is helpful with the biology, but so is meditation, relaxation, exercise, diet. That's the biological part. The psychological part has to do with the patterns that people have learned, the ways they've come to think about themselves and their condition. Sometimes people are more resilient. They look at problems to be solved rather than difficulties that will overwhelm them. Sometimes people learn that they are capable, that they do have people on their side, and we certainly want to encourage people to feel like they are not alone. Social has to do with the connections that you have with other people. People are biologically wired to reach out and be with other people. So that when people are not at their best, they very often avoid contact that might be sustaining or enhancing, or they hang out with people who are not the best for them, but they are comfortable. So we try to help people with both the biological, the psychological, and the social aspect of their condition. So in terms of identifying when people are at a risk for suicide, we look at the fact that people have some biological markers. When people are not sleeping well, eating well, when the depression has gotten to the point where they are immobilized, we know that their biology could be very powerful in terms of depression or suicidal risk. When people start to psychologically express feelings of hopelessness, isolation, being alone, desperation, then that psychologically is something that we look for. And socially, when people start to isolate themselves, when they are not connecting with other people who might provide them with the support and the social structure that would enable them to feel better about themselves, that's when we begin to have a direct discussion about people's suicidal risk.
Very comprehensive. And I've studied it myself, the biological, psychological, and social aspects of mental illness, or I don't know if we should say mental illness, mental conditions.
Well, we really don't like the term mental illness. We are unfortunately sort of stuck with it. And the reason why we don't like it is because mental illness in our society has some really connotations of not being acceptable, especially for veterans who feel like we're supposed to be able to handle everything and solve everything. Mental illness sometimes has a connotation that you don't deserve the help with the condition, that it's a condition that is somehow not quite human. What we think about is that if you went to a cardiac clinic, it would be because you have a condition of a basic organ system, your circulatory system. If you went to the diabetes clinic, you'd have a condition of a basic organ system, your endocrinology system. Coming to the mental health clinic is the same kind of thing. You have a condition of a basic organ system, your nervous system. And so it's no less deserving of treatment and no less human than any other condition. So we try to encourage people to look at this as something that you can still feel respectable, you can still feel honorable, and you can still get the help that you need and deserve. But the idea is that if you have a holistic approach and everything you have lived has become part of who you are now, then it's important that you be able to discuss issues of faith, spirituality, creativity, education, your general well-being in terms of housing and finances, and all of those things, because they all contribute to your well-being or to your lack of well-being. So that sometimes the best psychological thing you can do is to encourage people to get the help they deserve in a financial way, or to connect in their faith tradition, or to do something that helps with their creativity. And that really enhances people's well-being as much as talking about what happened in your past.
Yes, earlier at the summit, there were some of the speakers like Tom Miller from Joining Forces, Illinois, and they were talking about the many different social service organizations, nonprofits, churches, schools, universities, etc. And one of the valuable resources for veterans is right here at Hines Hospital, where you are a social worker.
Yes, part of the thing about being involved with the VA, although it's difficult for some people to initially engage in the VA, what we have, and is really very important, is the fact that everyone here is veterans, everyone here gets it, that being part of an organization means that you can not only get help, but you can also give help. I often say to people that some of the things that you may have learned about life may be a no-brainer for you, might be exactly the thing that some other veteran needs to know. So that the fact that you can both give help as well as get help is really crucial, and I think the VA is a very important place for doing that. We have a lot of veterans whose primary curative, restorative process is being involved in peer support or in other organizations where they can help veterans.
I thank you very much for inviting me, and it's been a very insightful summit.
Well, thank you for coming, and thank you for doing this.
All right, I'd like to say hello, my name's Dan, and I am thankful to be a veteran and in the Veterans Hospital. I did not get brain damage in the service, but I did get brain damage after the service, and they had me convinced from other hospitals that it was a brain tumor. And I was suicidal at that time because I thought I had a brain tumor. I went to different hospitals, different doctors, but then I came to this Veterans Hospital, and they diagnosed it as a frontal lobe of the brain damage. It was not a brain tumor. So ever since, I have been coming back to this Veterans Hospital to see different doctors who are saving my life, not making me suicidal. And I am thankful that I am a veteran, that they have come up with this, that it was not a brain tumor. Otherwise, I'd probably be suicidal. And, you know, today I'm lucky that I made it to my 56th birthday today. And I was very suicidal then. And my nephew come out of the Army, and he did commit suicide after the service. He did not come to the hospital. What happens is that bothers me. But I am just thankful, and I'm here today alive.